After we finished necrosis and gangrene, we are going to explain the other form of cell death, which is apoptosis. Look at the background in this slide. You can find what? This is autumn, okay? And apoptosis is related to autumn, فصل الخريف. Before explaining apoptosis, we need to remember the previous lectures. Let's solve this match question together. Okay, weightlifter. What happens to a weightlifter? Okay, what do you have? Yes, very good. Physiologic hypertrophy. So the weightlifter will have physiologic hypertrophy. Karyorexis means what? Yes, it is fragmented nucleus. Okay. Myelin figures. What are they? Yes, these are masses due to membrane damage. Phospholipid masses. They are word like that. Okay. Hemiplegia. What's hemiplegia? شلل نصفي. What's hemiplegia? Okay. Very good. We have what in hemiplegia? We have atrophy, and this is a pathologic form of atrophy, so it is the decrease in organ size. You don't have any other choice here. Reversible injury. You may remember reversible injury. We have what? Hydropic degeneration, and you have fatty change. So what you have here, very good, vacuolar degeneration or hydropic degeneration, which is the cytoplasmic vacuoles. Very good. Okay, superoxide. What is superoxide? Yes, this is one of the ROS. So, what do you match here? Oxidation of lipid, protein, and DNA. Very good. Another match question. Necrosis and putrefaction. Of course, this is gangrene. Very good. Tuberculosis. Okay, which type of necrosis? Caseous necrosis, cheesy, partial liquefied necrotic tissue, myocardial infarction. Myocardial infarction. Which type of necrosis? Coagulative type of necrosis. Okay, which matches with coagulative type of necrosis? Very good. Predominant protein denaturation. Very good. Traumatic fat necrosis. Very good. This is maybe mistaken for breast cancer in breast because it forms a hard mass in the breast. Acute pancreatitis. Okay, this is enzymatic fat necrosis by lipase. Very good. Fibrinoid necrosis is an immune reaction involving blood vessels. Very good. Very good. By the end of this lecture today, you should be able to define apoptosis, recognize and list the types of apoptosis, describe the pathological features of apoptosis, explain the mechanisms, and compare between the apoptosis and necrosis. What happens if you have this mild car accident and you have this severe car accident? Okay, which is repairable? This one? Yes, this one is repairable. Okay, so if I can repair this, I'm going to repair the car. This one is not repairable. So what I'm going to do with this car? Okay, I'm going to get rid of this car. Okay, so it is irreparable, so I'm going to get rid of this car, but I'm going to repair this one. And this is the concept of apoptosis. What is apoptosis? If a cell is irreparably damaged beyond the level of repair, what does the body do? Keep it or get rid of it with severe reaction or get rid of it with minimal reaction? What do you think? Of course, it is not repaired, so we are going to get rid of it, but without severe reaction. So we are going to get rid of it with minimal reaction, and this is apoptosis. And the example for apoptosis, which is the programmed form of cell death, is shown here in these leaves. Okay, in the leaves, in plants, some of the leaves just are irreparably damaged, like those yellow leaves, and so they just fall. So we have the fall, which is the autumn, فصل الخريف. There are a lot of these falling leaves which are yellow in color, okay? And this is programmed for renewing. This is for renewal of the leaves with new leaves, and so this is a programmed form of cell death, present in physiologic forms as in leaves, and present in physiologic forms in the body, as we are going to see. So apoptosis, this is from the ancient Greek word way, okay, or falling, is the process of programmed cell death that may occur in multicellular organisms. Apoptosis is a regulated mechanism of cell death that serves to eliminate unwanted and irreparably damaged cells with the least possible host reaction. So what do? We just get rid of the unwanted cells and the cells that are damaged and we cannot repair, but with the least possible host reaction. For example, when the cell is deprived of growth factors or its DNA and proteins are damaged beyond repair, the cell will kill itself by apoptosis, which is suicidal cell death. This apoptosis, which is a form of cell death, is characterized by nuclear chromatin fragmentation and fragmentation of the nucleus, fragmentation of the cell, okay, into parts like that, but with what? With complete membrane. So we don't have loss of the membrane integrity. We just transform this cell into smaller parts, particle like that, but each of them is surrounded by an intact cell membrane. And then we have the rapid removal, okay, phagocytosis of this apoptotic body or cellular debris by phagocytic cells and adjacent cells. So you are going to get rid of the cell very quickly. The cell is going to be fragmented, and each fragment will be eaten by phagocytic cell, and so this cell will just disappear, okay, without host reaction. Why don't we have a host reaction here? Because we have a continuous integrity of the cell membrane. And remember, in necrosis, what evoked the cellular reaction or the inflammatory reaction? It was the leakage of the contents outside the cell due to loss of membrane integrity. But we don't have this here, and so we don't have a host reaction. So the apoptosis occurs only in pathological conditions. True or false? Of course false. We have already seen that it occurs in physiologic conditions too. So the types of apoptosis, according to the etiology, may be physiologic and may be pathologic. The physiologic types of apoptosis occur during embryogenesis. What's embryogenesis? You remember from embryology that you form the organs. Of course, you have, for example, the GIT is formed of a solid tube. When GIT is formed, it is a solid tube. To form the lumina, you have to lose the cells in between. Okay, so you just remove the cells in between by apoptosis, and then you get a tube. This is embryogenesis and organogenesis. We may have physiologic hormonal apoptosis, for example, endometrial shedding. Remember the endometrium that we have. We talked about endometrium, and we said that the endometrium is the lining of the uterus. And we said that during the menstrual cycle, the endometrium undergoes proliferation and then secretion, and at the end of the cycle, it goes down, shedding occurs of endometrium, and menstruation occurs. This shedding is a physiologic process, and it occurs due to the stop of hormones at the end of the cycle. And so this is something physiologic that occurs each month, okay? So it occurs by what? It occurs by the process of apoptosis. So I'm going to have shedding of the endometrium by the process of apoptosis and not necrosis. Okay? So this is the endometrial shedding, which is a form of apoptosis, but physiologic form of apoptosis. Next, we have regression of lactating breast after weaning. Of course, you know that the breast during pregnancy undergoes hyperplasia of the acini, and so the acini will increase and prepare to form milk. So the acini in the breast will increase, and this increases the breast size. At the end of pregnancy, there is start of lactation. Okay, so we have this hyperplasia of the acini of the breast during pregnancy and for lactation. After weaning, الفطام, after stop of lactation, what happens? There will be regression of these lactating acini, and so I'm going to just go and remove all these excessive acini by the process of apoptosis, so to go back to normal. So the breast will regress to the normal size. So this is a normal or physiologic type of apoptosis occurring in lactating breasts after weaning. Proliferating population. What's a proliferating population? Proliferating population is a population of labile cells in continuous proliferative state. As for example, what? For example, we have the epithelium, skin. Okay, you have skin. You have the crypts in the GIT, for example, and so on. So you have the crypts, and you have these here stem cells that just go and proliferate, and you have here stem cells that proliferate. If you go and proliferate, you need a certain number here. If you exceed the number, okay, you have to go back to normal by decreasing this number. And so if you exceed the wanted number in a proliferating population, you just get rid of the excess cells by the process of apoptosis. علشان كده كل proliferating population بتبقى في balance. The balance is kept by the process of apoptosis. So proliferation increases the number, apoptosis decreases the number until we reach an equilibrium in these proliferating populations. Cells that serve their purpose, cells قامت بوظيفة وخلصت خلاص. We have cells that form a function, and then after the function stops, okay, we say thank you and we don't need you anymore. For example, neutrophils مثلا. Neutrophils come from the bone marrow in large amounts if I have some sort of infection by microbe somewhere. After the process of killing the microbe and okay, everything is okay, these neutrophils are not wanted anymore. They serve their function, and so we say thank you and just go and die by suicidal apoptosis. So these are the cells that serve their purpose. Okay, so they die by apoptosis as a physiologic form of apoptosis. Self-reactive lymphocytes. Okay, you know what are the lymphocytes? Lymphocytes are present as a part of the immune system, and they should just go and react to foreign bodies and foreign material or foreign microorganisms and so on. And if they go and just lose the tolerance and start to react to some of the self antigens, okay, if they go and react to some self antigen, lose the tolerance, and they don't remember this self antigen and start to react to this, we have to get rid of these self-reactive lymphocytes. If we leave them, we are going to pass into autoimmune disease. So we are just going to get rid of them by the process of apoptosis. Lastly, we have the involution of some organs as, for example, the thymus. You know, the thymus is one of the lymphoid organs that undergoes what? It undergoes physiologic atrophy and involution. And so involution of the thymus in early age is by the process of atrophy occurs. This atrophy occurs due to, remember the atrophy definition, decrease in the size of the organ due to decrease in the size of the individual cells, maybe with increased in the number of the individual cells. So the decrease in the number of the individual cells will be by the process of apoptosis, and this is the relation between apoptosis and atrophy we have said before in atrophy. So involution of thymus in early age occurs by the process of apoptosis. All these are physiologic forms of apoptosis. Pathologic apoptosis. As in cases of physiologic apoptosis, we have also pathological causes of apoptosis, starting with DNA damage. If you have DNA damage beyond repair due to irradiation or hypoxia, so the cell with DNA damage will be pushed into apoptosis. Number 2, tumors exposed to chemotherapy. Chemotherapy is the type of therapy that is given with patients with tumors. We have many types of chemotherapy and they work by different mechanisms. One of the mechanisms of chemotherapeutic drugs is by induction of apoptosis in tumor cells. So the tumor will regress in size or decrease in size by the use of this chemotherapeutic agent due to induction of apoptosis in the tumor cells. Number 3, cytotoxic T cells. Cytotoxic T cells represent part of the immune system. They act towards the virally infected cells, tumors, and graft or transplant. So the cytotoxic T cells are the main cells in the immune system against viruses, because viruses always go intracellular, okay, and they incorporate into the DNA of the nucleus, and so the virus is always inside the cell. These cells with which are virally infected are attacked by cytotoxic T cells. Tumors, as a part of tumor immunity, tumor cells are attacked by cytotoxic T cells. The negative or the bad effect of this cytotoxic T cell occurs in graft rejection. Graft is a transplant. You bring a part of an organ or a whole organ like the kidney and transplant it into the recipient. And so it comes from the donor to go to be transplanted into the recipient. So it is foreign for the immune system of the recipient, including cytotoxic T cells, and so they are going to go there and start to react to this foreign transplant and try to destroy it. And this is part of the immune system, and so in cases of transplantation, doctors usually give immunosuppressant drugs to suppress such immune reaction. In viral infections, as in cases of viral hepatitis, viral hepatitis C, there will be a killing of the virally infected cells by apoptosis, and these apoptotic bodies appear within the hepatocytes as small bodies called councilman bodies. So these councilman bodies are the apoptotic bodies, which represent the virally infected hepatocytes that are killed by the process of apoptosis, and this is mediated by cytotoxic T cells. Pathologic atrophy. Atrophy again, we come again with atrophy and apoptosis. We have heard about apoptosis in physiologic atrophy of the thymus, and here we hear about apoptosis in cases of pathologic atrophy. For example, after duct obstruction, if you have a duct and this duct just drains acini like that, so it drains acinar cells, and this is the duct. If I have duct obstruction, this will lead to back pressure and this back pressure will lead to killing or death of the acinar cells by the process of apoptosis, leading to reduction in the number of the cells in the acini, and so the acini will undergo atrophy and the number of the cells lining these acini will decrease, and this contributes to the atrophy. So pathologic atrophy after duct obstruction, for example in pancreas, will lead to is mediated by apoptosis or is helped by apoptosis. Lastly, we have the misfolded proteins. What is a misfolded protein? Misfolded proteins are proteins that are formed within the endoplasmic reticulum and they lack the proper folding, and so they cannot be secreted. In cases of endoplasmic reticulum, you know that we have ribosomes here over the RER, and the protein is synthesized by these ribosomes, and then it goes inside to be folded like that within the endoplasmic reticulum to be ready for secretion from the endoplasmic reticulum, going to the Golgi apparatus for packaging and so on. Fine. And so the start of proper folding of the proteins present inside the endoplasmic reticulum is important for the completion of the sequence of protein synthesis. If I have misfolded proteins, as in cases of degenerative diseases of the CNS, for example Alzheimer's disease, what happens? These proteins are formed inside the endoplasmic reticulum, but they fail to have proper folding, and this misfolding will lead to increase in the number of the misfolded proteins with failure of their secretion from the endoplasmic reticulum. And so the endoplasmic reticulum will be stuffed with these misfolded proteins that cannot be repaired. This will drive the cell into the process of apoptosis. So if I have accumulation of these misfolded proteins inside the neurons of the brain, in the degenerative diseases of the brain, what will happen? The neurons will die by apoptosis, and by time I will have decrease in the number of neurons in the brain. This will lead to the reduction of the nerve cells, and this will lead to the degenerative disease of the CNS like Alzheimer's disease, because I lost a lot of neurons with their function. And of course, you know that they are permanent cells, and so when you lose some cells by apoptosis, you do not compensate for these cells, and this will lead to decrease in the number of neurons by time, leading to manifestations of Alzheimer's disease as dementia, as loss of a lot of cognitive functions, and so on. Okay, so pathologic apoptosis can occur in cases of DNA damage beyond repair due to irradiation or hypoxia, tumors exposed to chemotherapy, reaction of some chemotherapeutic drugs, cytotoxic T cells acting upon virally infected cells, tumors, or even graft, leading to rejection of this graft. And in case of viral infection, the apoptotic body is called Councilman body. Pathologic atrophy is another example for pathologic apoptosis. And lastly, we have the misfolded proteins as degenerative diseases of the CNS, in which you have accumulation of this misfolded protein inside the endoplasmic reticulum with failure of proper folding, leading to induction of apoptosis in these neurons, and by time I have diminished number of neurons in the brain, leading to the manifestations of these degenerative diseases as Alzheimer's disease. Here we are going to talk about the morphology. The morphology of apoptosis. As we have said earlier, apoptosis is a kind of death in which I have a convolution of the cell membrane without loss of integrity. I have fragmentation of the cell into parts like that, and inside I have fragmentation of the nucleus, and so these parts will contain part of the nucleus and part of the organelles, surrounded totally by part of the cell membrane. These are the apoptotic bodies, and these apoptotic bodies are rapidly phagocytosed by adjacent cells and phagocytic cells. If you look at a liver section like that, in cases of hepatitis C virus infection, what happens? Of course, you know that hepatitis C virus is a viral infection affecting hepatocytes, and usually the virus is intracellular. And so these hepatocytes that are infected with the virus are attacked by these cytotoxic T cells, which stains blue. You know, these are the cytotoxic T cells. These cytotoxic T cells go and surround the infected hepatocytes, and then after they come here in contact with the infected cell, they go and induce apoptosis in this cell. This cell will have what? It will be shrunken. Apoptosis leads to shrinkage of the cell with increase in the cytoplasmic eosinophilia, pycnosis or karyopyxis, and then the cell will disappear. Look at this. This is a cell, okay, here, and this is another cell. If you compare this cell to the hepatocytes, it is much smaller in size, leaving a halo. So it is shrunken. When it is shrunken, okay, like that, it will be surrounded by a halo. Fine. So it becomes shrunken, and the cytoplasm becomes more condensed due to loss of water, and then the nucleus is pycnotic. And this pycnotic nucleus, I have a pycnotic nucleus, and then it will be karyopyctic like that, okay, and after that I have what? I have the development of convolutions of the membrane like that. These convolutions are then going to be transformed into small parts, so the cell will be divided into small parts. Each part of them contains part of the nucleus and some organelles along with an intact cell membrane. Fine. If you look at this, this is the Councilman body present in cases of viral hepatitis infection, and of course these are actually apoptotic bodies, and this apoptosis is induced by these cytotoxic T cells. Fine. Okay. So here we are going to talk about the morphology of apoptosis. It affects single cells or small clusters. You can find here a single cell, and again here in the case of skin, as you remember, rapidly proliferating population, we have a single cell here. So it affects single cells like that, or very small clusters, not big clusters in case of necrosis. In H&E stained tissue sections, apoptotic bodies appear as round or oval masses with intensely eosinophilic cytoplasm like that. This is one, and this is another one. The nuclei are dense and show pycnosis or karyopyxis. They can show pycnosis like this one, or karyopyxis. This is another pycnotic nucleus, or karyopyxis. Why don't we have karyolysis? The process is very quick, and so you don't wait until the nucleus is completely dissoluted, and so the nucleus will be pycnotic or karyopyxis, and the cell will be lost before the process of total karyolysis. We have also here convolutions here. Look at this. This is an apoptotic cell seen by ultrastructure. Look at the cell membrane convolution. So the membrane have these convolutions, and look, the nucleus is pycnotic and here pycnotic, and then start to be karyopyctic, okay. And then we have what? Look at this. Here we have these are the cells with the karyopyctic nuclei, okay. And you have here another cell and here another cell. They start to have these condensed chromatin chromatin is becoming condensed, and this will start pycnosis followed by karyorrhexis. If you look at this cell again, you have this karyorrhectic nucleus, fine, and then I'm going to have these small particles containing small part of the nucleus and part of the organelle surrounded by a membrane. These are the apoptotic bodies that will be phagocytosed by the adjacent cells. Does apoptosis elicit inflammation? Yes or no? No inflammatory reaction. Okay, why? We have two factors responsible for that. The first one is that we have intact cell membrane. These convolutions are associated with intact cell. The second point is the rapid phagocytosis of these apoptotic bodies by macrophages and adjacent cells, and so the cell will completely disappear. The mechanism of apoptosis. To reach this target, what do we need? It is characterized by enzymatic degradation of proteins and DNA initiated by caspases and other enzymes. So the apoptosis, to reach the convolutions, the karyorrhexis, and the appearance of apoptotic bodies containing part of the nucleus and few organelles like that, okay, this needs what? This needs degradation of the proteins and DNA. We need to degrade the DNA present in the nucleus, and we need to degrade the cytoskeletal proteins to allow these convolutions to occur. This degradation of proteins and DNA is initiated by caspases and other enzymes. You remember caspase. Caspase is one enzyme very important in the process of apoptosis. These caspases, when activated, will lead to activation of endonuclease, and this endonuclease will degrade the DNA. As you remember, endonuclease degrade DNA, resulting in pycnosis and karyorrhexis. Other enzymes involved in the process of apoptosis are responsible for destruction of nucleoproteins and the cytoskeletal proteins, and these cytoskeletal proteins are responsible for the integrity of the membrane. If you just go and damage the cytoskeletal proteins, this will allow you to have these convolutions of the membrane and formation of apoptotic bodies. And so we need caspase and other enzyme activation to reach the apoptotic body formation. How can this be? How can these caspases activated? And how are they inhibited? The mechanisms of apoptosis. We have two main mechanisms of apoptosis. One of them starts from a death receptor present on the cell membrane, and so the signal comes from outside, so this is called the extrinsic pathway. The other one starts within the mitochondria, and so it occurs within the cell, so it is called intrinsic pathway. So the mechanisms of apoptosis include two pathways, extrinsic pathway and intrinsic pathway. The extrinsic pathway depends on the presence of that receptor on the surface of the cell, and the intrinsic pathway is mediated by changes in the mitochondrial membrane. So this is called intrinsic pathway. The intrinsic pathway of apoptosis, or the mitochondrial pathway of apoptosis, is controlled by a family called BCL2 family. This BCL2 family is named after BCL2, which is the most famous member of this family. BCL2 family is a family of proteins. Some of them are activator of apoptosis and called pro-apoptotic, as BAX and BAC, and some of these groups are anti-apoptotic, against apoptosis. They prevent apoptosis, so these prevent apoptosis, as BCL2 as a member and BCLXL. So we have BCL2 family that controls the mitochondrial pathway of apoptosis, we have pro-apoptotic BCL2 family proteins and anti-apoptotic proteins. The pro-apoptotic enhance apoptosis, and the anti-apoptotic prevent apoptosis. Okay? Let's see what happens with the mitochondria to induce apoptosis. Remember that we have a mitochondrial membrane, and this BCL2 family just go and reside here on the surface of the mitochondria. يبقى ال BCL2 family members دول موجودين على الممbrane of mitochondria. Why? They control the permeability of the mitochondrial membrane. How can this be achieved? Okay, we have channels here. So we have channels present on the mitochondrial membrane, and these channels are formed of bags and bag proteins. So the bags and bag proteins represent these channels here. If you have this channel opened, you can have escape of the mitochondrial contents outside the cytoplasm. And so these channels are formed by bags and bag. To prevent this leakage and decrease the permeability of the membrane, you have just to lock these channels. How can you lock these channels? These channels are locked by the anti-apoptotic members of BCL2 family, which are BCL2 and BCLXL. These will form locks, okay? They will lock these channels, stop these channels. And if they go and stop these channels, so the permeability of the mitochondrial membrane is markedly decreased. This prevents the escape of the proteins from inside the mitochondria to the cytoplasm. And this is important because this escape will lead to activation of what? Activation of the caspase cascade will lead to apoptosis. So in case of the need of the cell to live, okay, if I want the cell to live, so I need to stop apoptosis. How can I do this? Simply just go and close these channels. So the channels are closed, so I'm going to inactivate bags and bag and activate the BCL2 and BCLXL. When they are activated, they will close the channels of bags and bag, leading to maintenance of the contents of the mitochondria inside, and it will prevent the leakage of these enzymes to the cytoplasm, and so caspase is not activated. Okay, on the contrary, if I want to drive this cell into apoptosis, what I'm going to do? Simply go and release the inhibitory effect, prevent this inhibition, and so take BCL2 and XL away from the channel, and so the channels of bags and bag will be opened like that, and the permeability of the mitochondrial membrane will increase. This will lead to escape of some of the enzymes that are responsible for the oxidative phosphorylation as cytochrome C enzyme into the cytoplasm. When cytochrome C goes into the cytoplasm, it will meet caspase, leading to activation of caspase cascade. This will eventually lead to the process of apoptosis. And so the mitochondrial pathway or intrinsic pathway of apoptosis depends on the BCL2 family. In cases that I want the cell to live, I need to stop apoptosis, so I'm going to activate the anti-apoptotic proteins BCL2 and XL, okay, to close the channels of bags and bag present on the mitochondrial membrane, leading to decrease in the mitochondrial membrane permeability, and this will stop or prevent the leakage of enzymes from inside the mitochondria to the cytoplasm, and so caspases are not activated. Okay, in case I want the cell to be driven into apoptosis, I do the opposite. What is that? I remove the BCL2 and XL inhibitory effect, and so this will lead to the opening of the channels mediated by BAX and BAC on the mitochondrial membrane, and then I have escape of the cytochrome C enzyme from the mitochondrial matrix to the cytoplasm, leading to activation of the caspase cascade and induction of apoptosis. After we talked about the BCL2 family interplay on the mitochondrial membrane to stimulate or inhibit apoptosis, we are now going to see what are the factors that trigger this mitochondrial pathway. Let's see the cell membrane, and the cell membrane has receptors on the cell membrane. These receptors for hormones, for example, or some receptors are for cytokines, some receptors are for growth factors, and so on. So I have growth factor receptors. We have inside, here is the mitochondria, and on the mitochondrial membrane we have the interplay between the anti and pro-apoptotic proteins, fine, and we have the nucleus, and this nucleus has its DNA, and we have the endoplasmic reticulum, and the endoplasmic reticulum has inside its protein synthesis, protein inside, okay? Growth factors react with growth factor receptors, hormone react with receptors, cytokine react with receptors on the membrane, and when they react with the receptors, there are some sensors like that. These sensors, with this reaction, just go here to the mitochondria to stimulate what? To stimulate the anti-apoptotic proteins to decrease the permeability of the mitochondrial membrane and keep the life of the cell. Okay, what happens if I don't have a growth factor? The cell is deprived of growth factor, or deprived of hormones, or deprived of cytokines, depending on each cell. What happens? Again, we have another sensor here, عندنا هنا عصفورة أو sensor, and this sensor also is one of the proteins belonging to the BCL2 family. So, okay, these sensors will go this time, and they will stimulate the pro-apoptotic proteins. Why? Because with the loss of hormones, growth factor, or cytokines, we know that this cell is not needed anymore, and so this cell should be pushed into apoptosis. It served its function and it is not needed anymore, so we are going to push this cell into apoptosis. So the absence of reaction between hormone, growth factor, or cytokine with the receptor will stimulate some sensors here near the membrane, okay, and these sensors will go to stimulate the pro-apoptotic proteins and inhibit the anti-apoptotic. So they are going to remove the anti-apoptotic BCL2 and BCLXL, leading to opening of the channels with BAX and BAC. So BAX and BAC will be back here to work, and this will lead to escape of the cytochrome C and other mitochondrial proteins outside the mitochondria. So I have cytochrome C here, plus other proteins, and this will go to activate the caspases to start the process of apoptosis. Fine. And so this is the first one. Next, we have DNA damage. We have the DNA inside the nucleus, and this DNA is kept under control of a guardian called P53. So we have P53 is one of the guardians responsible for the safety of DNA. So if I have a DNA damage, okay, if I have some damage in the DNA, as that, we have damage of DNA like that by irradiation or by anything that caused this damage in here. So this damage of DNA stimulates the p53. This p53 will stop everything to see what we are going to do with this damage. Can we repair this damage? Okay, so p53 will go to activate the repair enzymes. If the repair enzymes are unable to repair this DNA, so p53 will send sensors to stimulate the pro-apoptotic proteins back and back to induce apoptosis. So p53 is the guardian of the genome. It is responsible for the control of DNA safety. So if there is DNA damage due to any cause, p53 will start to activate the enzymes responsible for repair of this DNA. If they don't work, or if DNA repair is not possible, so p53 will go and stimulate pro-apoptotic proteins back and back, and this will lead to induction of apoptosis in this cell due to inability of the cell to repair its DNA. So this is the other induction of apoptosis after DNA damage. Third, we have protein damage beyond repair, which means protein misfolding, and this protein misfolding, as we said before, will lead to failure of secretion of protein from the endoplasmic reticulum, and so the endoplasmic reticulum will be stuffed with this protein, and this will lead to what is called endoplasmic reticulum stress. With endoplasmic reticulum stress, of course, as what happened inside the nucleus, there is some trial to repair or this unfolded protein. If this repair process is not done well, or if it fails, so I have sensors here plus beneath the endoplasmic reticulum. These sensors will go to the mitochondria to stimulate the pro-apoptotic back and back and inhibit anti-apoptotic proteins so that it will push the cell into apoptosis. So the trigger of mitochondrial pathway, which is the intrinsic pathway of apoptosis in most of the cases, is triggered by either loss of growth hormone or cytokine or growth factor stimulation to the cell, or DNA damage beyond the ability of the cell to repair. And here p53, which is the guardian of the genome, is the major maestro in this process. If it pushes the cell into repair, or if repair is not fine or is not possible, so the cell is pushed into apoptosis. And lastly, we have the endoplasmic reticulum stress due to the misfolding of the protein. If we cannot repair this misfolding and do proper folding, so I'm going to push the cell into apoptosis by what is called endoplasmic reticulum stress. Again, here is the text of what we have seen in the previous figure. The mitochondrial or intrinsic pathway is triggered by loss of survival signals of the cell, DNA damage beyond repair leading to p53 activation, and this will start, as we said, repair if it is not possible, so it pushes the cell into apoptosis. Accumulation of misfolded proteins leading to ER stress, as in cases of Alzheimer's disease, for example. All these factors will activate the pro-apoptotic members of the PCL2 family, which are back and back, that are present on the mitochondrial membrane, leading to increased permeability of the mitochondrial membrane. The leakage of the cytochrome C from the cytoplasm will lead to activation of the caspase. In case of caspase to be activated is called caspase 9, and this is so we have an initiator in this cascade called caspase 9, and this will be activated by the cytochrome C. And of course, this is a cell death. It shouldn't go into 2 steps. It should have several steps. And so this caspase 9 will go and activate different caspases until it reaches the executioner caspase, which is caspase 3. And activation will go to activate what? Will go to activate the endonuclease and the other proteins that will end into apoptosis. Remember that cytochrome C escapes from the mitochondria together with other mitochondrial proteins. These mitochondrial proteins will block the activity of caspase antagonist present in the cytoplasm, which makes caspase free to be activated by the cytochrome C and continue the cascade of caspase activation, ending in apoptosis. Can the cell regulate intrinsic pathway of apoptosis? Of course. We have pro-apoptotic and we have anti-apoptotic proteins. And so when we have pro and anti, we can always control. To go into apoptosis, we have activators. Are the activators backs and back members of the BCL2 family, which represent the channels. These represent the channels present on the mitochondrial membrane. So these are the backs and back. What else? We have P53, and P53, which is the guardian, will go and stimulate the backs and back. So it is with the process of apoptosis. It is pro-apoptotic or activator. What are the inhibitors of apoptosis? These are the blockers. What blocks this? What blocks this is the plug that blocks this one. These are the anti-apoptotic members of BCL2 family, which are the BCL2 and BCLXL. So if the cells are exposed to growth factor signals, there is synthesis of anti-apoptotic members of BCL2 family in excess, and their activation will lead to blockage of these channels, okay, and these channels will be blocked by these anti-apoptotic members of the BCL2 family, and so we are going to prevent the escape of the mitochondrial proteins outside. Okay, so these are the inhibitors of apoptosis. The other pathway of apoptosis, which is responsible for the minority of the causes of apoptosis, is called death receptor or extrinsic pathway. And why do we call it extrinsic pathway? Because it starts from outside. So the signal starts always from outside by the use of one of the death receptors present on the cell that is required to die by apoptosis. This death receptor or extrinsic pathway is responsible for elimination of self-reactive lymphocytes. Okay, so any self-reactive lymphocyte will be eliminated by this pathway, also killing the target cells by the cytotoxic T lymphocytes. Remember, what are the cells that are killed by cytotoxic T lymphocytes? Okay, from previous slide, we have 3. First one is virally infected cell. Okay, number 2, which cell is targeted by cytotoxic T cell? Tumor cells as a part of tumor immunity. And lastly, the unwanted effect is graft rejection or transplant and killed by the process of apoptosis. So these are the 2 main triggers for death receptor pathway: a self-reactive lymphocyte elimination and killing target cells by cytotoxic T lymphocytes. It is initiated by death receptor, which is FAS or TNF1 receptor. These are surface molecules and are members of the TNF receptor family, tumor necrosis factor receptor family. So TNF is tumor necrosis factor receptor family, and always these death receptors are expressed on the surface of virally infected cell or tumor cell or even in graft cells. the Fas receptor, which is the death receptor, are engaged by ligands on the T cells. So the T cells come, okay, let's have another color for T cells here, okay, let's say blue. So this is the death receptor and this is the T cell, cytotoxic T cell. Each cytotoxic T cell has ligands for the death receptor. So it has a ligand here, and this ligand is specific for this receptor. So I have the T cell with, this is the Fas, so this is the Fas-L, Fas ligand. Okay, so the Fas receptors are engaged by the ligands Fas-L on the T cells. Then look at this one. This is the Fas, okay, Fas-L, and this is the Fas. So after this engagement here, what happens? There will be activation of one of the procaspases. This time is procaspase 8, and this will activate the caspase 8, which is the initiator caspase in this one, initiator. Fine. So the engagement of Fas with Fas-L on the cytotoxic T cell, so this is the cytotoxic T cell here, will lead to what? This will lead to activation of procaspase 8. This is beside the Fas receptor, and this procaspase 8 will be activated into caspase 8. Caspase 8 will go and activate the caspase 3 to complete the cascade of apoptosis, okay, of caspase activation of apoptosis. Also, tumor necrosis factor 1 together with tumor necrosis factor, as in cases of autoreactive T lymphocytes, will go and engage with the same receptor, and this will again activate procaspase 8, and this will be activated to caspase 8. Then it will go and activate caspase 3 to complete the pathway of caspase activation. Okay, so this is the initiator here is 8. Remember, in the mitochondrial pathway, intrinsic pathway, it was 9. Here it is 8. How can I remember 8 from 9? Remember, this is the extrinsic pathway, and extrinsic pathway starts with E, and 8 starts with E. So E with E, 8 with extrinsic pathway. This will be much easier. The cytotoxic T cell is not stupid. This is a smart cell, and the smart cell wants to kill the target cell by any means. Okay, so it goes and interacts with the ligand like that. The ligand interacts with the receptor like that to start the apoptosis. At the same time, this cell just go and adhere to the affected cell or the target cell and starts to perforate the cell and inject granzyme. This is the granzyme B, and this comes from cytotoxic T cells. Okay, so the cytotoxic T cells also secrete what is called granzyme B, and this granzyme B is injected through the cell membrane of the target cell, and this granzyme B just goes and directly activates caspase 3. So caspase 3 is activated through the initiator caspase here, which is caspase engagement of the receptor with the ligand, and again the cytotoxic T cell will just go and inject granzyme B, which is an enzyme produced by the cytotoxic T cell. It is injected through the cell membrane of the targeted cell, and it goes directly to activate caspase 3, which is the executioner caspase, to ensure that this cell will be killed by apoptosis. Again, this extrinsic pathway, it needs some enhancement. So this intrinsic pathway, look at this figure, it goes here, and caspase 8, after its activation, it sends one of the sensors here to the mitochondrial pathway, and this sensor will go and activate the pro-apoptotic proteins on the mitochondrial membrane, which are Bax and Bag, and this will initiate the mitochondrial pathway in addition. So the cytotoxic T cell actually wants to kill the cell by all means. So it starts by engagement of the Fas with the Fas-L on the membrane receptor protein present on the activated T lymphocytes, and these engagement will lead to what? This will lead to activation of procaspase 8. Fine. Fas cross activation of caspase 8 initiate the caspase activity, and this will activate caspase 3. Also, caspase 8 can activate another sensor here called BID, part of the BCL2 family, and this will go to activate the mitochondrial pathway to give a lethal blow to the cell, trying to kill this cell. Also, in addition, what happens? We have also granzyme that is produced in cytotoxic T lymphocytes, and it is just injected into the affected or targeted cells to directly activate caspase 3. So if we go and see how is caspase 3 activated in case of cytotoxic T cell targeting one cell to kill, it is activated by 3 means. The first one is the engagement of the Fas receptor, which is the death receptor, with the Fas ligand on the cytotoxic T cell, and this will initiate activation of caspase 8, which is the initiator caspase, and caspase 8 will go to activate caspase 3, and this will continue the process of apoptosis. Second, it will be activated by the mitochondrial pathway secondary to activation of caspase 8, and so mitochondrial pathway will help in the killing the cell by apoptosis in case of cytotoxic T cell. Fine. Lastly, the third method of cytotoxic T cell killing the cell by apoptosis is by direct injection of granzyme B into the affected cell, and this granzyme goes directly to activate caspase 3, and caspase 3 will be activated by 3 ways: by caspase 8 mainly, also by caspase 9. This is activated by the mitochondrial pathway secondary, activated from this death receptor pathway, and lastly also by direct activation from granzyme B that is injected into the affected cell. This will give the cytotoxic T cell what? قوة قتل ثلاثية. قوة قتل ثلاثية. So the cytotoxic T cell will kill the targeted cell by 3 means. 3 means, mainly death receptor, granzyme, and secondary activation of the mitochondrial pathway. Fine? تمام. This diagram summarizes what we have said as the mechanism of apoptosis. We have the mitochondrial or the intrinsic pathway, which is responsible for most cases of apoptosis. This is activated by growth factor withdrawal, DNA damage, or protein misfolding, endoplasmic reticulum stress, and this will lead to activation of the BCL2 family pro-apoptotic proteins back and back, and inhibition of the BCL2 and BCLXL. This will lead to increased permeability of the mitochondrial membrane here to release cytochrome C and pro-apoptotic proteins. Cytochrome C will activate initiator caspase, which is caspase 9, and this will lead to activation of caspase, executional caspase, which is caspase 3. The extrinsic pathway, which is mediated mainly by the death receptor present on the cell membrane, when we have interaction between the receptor and receptor ligand, Fas with Fas-L or TNF receptor with TNF, this will lead to activation of adapter proteins, which are procaspase 8, and this will activate initiator caspase. In this case, it will be caspase 8, and caspase 8 will activate caspase 3. This is the main pathway, and this caspase 3, what is going to do what? It is going to activate the endonuclease, leading to fragmentation of DNA and karyorrhexis of the nucleus. along with breakdown of the cytoskeletal proteins, which helps the cell to have convolutions of the membrane. With these convolutions, we have here formation of apoptotic bodies, and these apoptotic bodies contain parts of the nucleus and organelles living. These organelles are intact organelles, these are not digested and surrounded by a membrane. This apoptotic body will be rapidly phagocytosed by phagocytic cells and adjacent cells. Cellular features of necrosis and apoptosis. Look at this. Here we have a cell, normal cell. Here this cell is dying by apoptosis, and here the cell is dying by necrosis. Can you compare cell size, cell membrane, and cell organelles? Cell size, which is increased and which is shrunken? Of course, look at the apoptosis, it is shrunken, so it leaves a halo. Look at necrosis, it's swollen, imbibes a lot of water, and it is swollen, so it is increased in size. Look at the cell membrane, which is intact and which is disrupted. The cell membrane here has convolutions, but it is always intact. Look at the necrosis, you have a disrupted membrane, and this will lead to leakage of the contents outside. Okay, and this will elicit inflammation in case of necrosis. Cell organelles, which is intact and which is the digested organelles. Look here, you have the intact mitochondria, intact endoplasmic reticulum. Even after their phagocytosis, they are still intact inside. Look at this necrosis, you have digested organelles by lysosomal enzymes that resulted from lysosomal rupture. So these are the differences between the morphologic features of necrosis and apoptosis. Here we have a comparison between necrosis and apoptosis. Necrosis is cell death followed by degradation and inflammation. Apoptosis is a programmed cell death. The necrosis is always pathologic. Apoptosis may have physiologic causes and may have pathologic causes. The morphology of necrosis, we have inflammatory reaction. In apoptosis, no inflammatory reaction. Necrosis affects groups of adjacent cells. Apoptosis affects single cells or small clusters. Necrosis shows cell swelling. Apoptosis shows cell shrinkage. Membrane is disrupted in necrosis, but it is intact with convolutions in apoptosis. There are damaged organelles in necrosis, but in apoptosis they are intact within the apoptotic bodies. The nuclear disruption in necrosis includes pycnosis, karyorrhexis, and karyolysis. Also, we have chromatin condensation in apoptosis in the form of pycnosis and karyorrhexis. Phagocytosis occurs in necrosis, and it occurs also in apoptosis. All dead cells are phagocytosed eventually. The mechanism of necrosis includes lysosomal breakdown, while there is intact lysosomes in apoptosis. Mechanism of necrosis includes ATP depletion, membrane damage, free radical injury. In apoptosis, I have hormones and enzymes as FAS, BCL2, B53, and it needs a lot of energy. Although there are distinctions between necrosis and apoptosis, these two forms of cell death may exist and may be related, and there is some form of combined cell death called necroptosis. It starts as if the cell has some energy and it is pushed into cell death. It starts the cell death by apoptosis, trying to avoid a lot of damage and inflammatory reaction. But if the cell is deprived totally of energy, the process of apoptosis will go and pass into necrosis. وبالتالي ممكن قوي ان في الباثولوجيك كونديشنز ان الخلايا تبدأ انها تحاول تموت بالابوبتوزيس لو لسه معاها انرجي، انما لو كانت ديبليتد من الانرجي تماما هتبدأ وتخش في النكروزيس. فممكن تبدأ بالابوبتوزيس وتعدي على النكروزيس، او ممكن تبدأ من النكروزيس من الاول، او يبقى في حاجة كده combined فيها features مشتركة اسمها necroptosis. This is the summary of apoptosis. Let's have some questions. All the following features characterize apoptosis except means you choose the opposite one. Death of single cells or small clusters, this is apoptosis. Cell shrinkage, this is apoptosis. Intact organelles with apoptosis. Chromatin condensation, pycnosis, karyopyxis with apoptosis. Profound, severe, profound means severe. Inflammatory reaction, this is not apoptosis, this occurs with necrosis. We have minimal or no inflammatory reaction. So the answer is profound inflammatory reaction. So we have to choose this one. Question 2. Cellular apoptosis with loss of single cells plays a significant role in the histopathologic appearance of brain infarction. Is this apoptosis or necrosis? This is liquefactive necrosis, if you remember. Tuberculosis, yes, this is caseous necrosis, not apoptosis. Myocardial infarction, yes, this is coagulative type of necrosis. Viral hepatitis, remember councilman bodies? Yes, this is apoptosis. And so apoptosis will play a role in which in the histopathologic appearance of which, of course, in viral hepatitis, all these are types of necrosis and not apoptosis. Thank you very much.